Hi, this is Dr. Ryan Bell with Yada Yada. Let's talk about ADHD. So, as far as a quick introduction to ADHD, some of the important points are, first of all, there are options other than medications. So, for a lot of kids that have some symptoms of attention deficit disorder or attention deficit hyperactivity disorder, a lot of those kids don't need medications. And our approach is usually that we don't want to put them on medications unless they are functionally struggling. If they're not doing well with school, if they're struggling with their schoolwork, or if they're struggling with their behavior and social interactions. It's important that if you're concerned about your child having some of these symptoms, that you do a formal assessment. So this can be as simple as a paper that parents fill out, a paper that school teachers fill out, and then your physician can score those assessment sheets and decide if your child meets the criteria for ADHD or ADD. If they do, the options that you'll discuss with your physician will be, first, is it appropriate to just do behavioral modification therapy with a mental health professional, or does your child qualify and need medication options in order to help with their symptoms and their ability to function? Sometimes we'll recommend that patients do both of these, with a behavioral approach as well as a medication approach. Medications have some side effects, which we're always watching out for. Common side effects, if we go the medication route, include trouble with sleep, trouble with appetite, and changes in their overall personality. So we don't want kids to be overly dramatic. We don't want them to be more depressed. We don't want them to be more violent. We don't want them to go into zombie mode. So if there are any of those side effects as you start taking medications, then you have the option to discontinue the medications. Those medications are out of their system within the day, usually within 8 or 9 hours if you're on an extended release medicine, or 3 to 4 hours if you're on a short-acting medication. So side effects are always something that we're thinking about with ADD and ADHD. If you're concerned about your child and their symptoms, talk to your physician. There should be options to do a formal evaluation and make a decision as to whether your child is likely to benefit from either behavioral therapy or medication therapy for ADHD or ADD. Thank you.